Is it more challenging to provide high-quality healthcare in rural communities across the Commonwealth of Pennsylvania? Today on Conversations with Clint, I'm going to be starting a 2-week series talking about healthcare in rural communities and some of the challenges that we face here in north central Pennsylvania. We're also going to be talking about House Bill 533, a bill that we have introduced and passed in the House of Representatives and hope to see some action on this year in the Senate. I'm going to be joined by James Noble, who is the President and Chief Executive Officer of North Penn Comprehensive Health Services, as well as Janie Hilfiger, the President of UPMC Wellsboro and of UPMC Cole in Coudersport, Pennsylvania. So these folks truly understand rural healthcare, and we're going to actually have Jim here in our studio, and I'm going to be joining Janie in her office later this week. So we hope you can stay tuned and learn a little bit about some of the challenges that we face in rural healthcare here in the Commonwealth of Pennsylvania. So we are joined today by James Noble, who is the CEO of North Penn Comprehensive Health Services. Thank you, Jim, for joining us.
Clint, thank you. It's great to be here.
Thanks for coming out on such a snowy, kind of miserable day.
Well, it's northeast Pennsylvania. This is normal weather for us.
That's right.
We're not going to let that stop what we have to do.
Yeah, that's right. Well, today we're going to be talking a little bit about challenges in rural healthcare. Yes. And Jim, you have been serving for a number of years at the Laurel Health System, which was what we used to call the Laurel Health System, and now it's called North Penn Comprehensive Healthcare, right?
Yep.
And it's so much more than just a doctor's visit, right? I mean, that's what we used to think of Laurel Health, but you have really transformed this. You've been in the military, you've served in the Navy for a lot of years. Yep. Was it 25 years?
Yep, just over 25 years.
Wow. So you bring so much experience, not only in healthcare, but how you can approach some of these challenges from your experience in the military and in the Navy. So thank you for joining us, and we're going to have a great conversation today about healthcare, and that's what we're hoping people will be able to maybe understand a little bit more about the challenges that you face every day here in rural Pennsylvania. So you have been extremely active and engaging in our community to really assess the challenges that we face. What would you say are some of the biggest challenges in rural healthcare today?
Mm-hmm. Just the name itself, rural healthcare, it sets its own challenge, and that's one of the things that we have to negotiate through that some of our counterparts in the more urban environments don't really have to shoulder that. Being in a rural part of the country, in a rural part of the community here, recruitment is very challenging for us. And after I joined the system here 2 years ago, and prior to that, after retiring from the Navy, I worked in the area for about 7 years with Guthrie. That's something I refuse to accept. I understand the challenge, and I know the challenge is there, but I also understand the importance of really having a vision and having a path that you're traveling on. And I believe that professionals, particularly doctors, nurse practitioners, physician assistants, all the professionals we bring in, they want to be on a team. They want to be on a train that's going somewhere. So if you can articulate that vision and say, hey, come on board, we're going somewhere, and it's going to be really cool where we're going. We're not quite sure where we're going to end up, but the train is going somewhere.
It's so interesting to see that. I hear you talk about that because I see it in our community. When people come to rural Pennsylvania, they're joining a team. Yep. I mean, that's what's so interesting. I mean, later we're going to be talking with Janie Hilfiger, the president of UPMC.
Yes.
You would think in a lot of areas that those would be like arch enemies, but we work together. We have to.
Oh, absolutely. Janie and I have a great working relationship. I can't say enough about her. She's been in the area here for 45 years, started as a nurse, and then worked her way all the way up through the ranks, and now president of not just Soldiers and Sailors, but Charles Cole Hospital as well, so 2 rural communities. It really is important for us, and it's an integral part of our care delivery model, that the 2 organizations work seamlessly together. Yeah. They have to, and it's really for the good of our patients.
That's right.
So we can't have any sort of differences. It has to be a seamless approach. When patients come into the outpatient clinics, they go into the hospital for their diagnostic care or testing. God forbid if they have to be admitted, but we understand that's a part of life. Yep. We want them to do that, and then transition right back into the primary care office, so we can do that very seamlessly. and all that happens behind the scenes. The
Right.
patient shouldn't experience any bureaucracy going through the layers of the healthcare system.
Well, I appreciate the work that you've done, and I've really noticed that it's a team effort. And I think I grew up in this area, and I've known Laurel Health. We talked about it a little bit, but it always seemed like, okay, it's a doctor's visit. But let's talk a little bit about the fact that now it's a comprehensive healthcare basically system and network.
Yep.
What are some of the changes that you've done and made to the what we would have maybe pictured in the past of Laurel Healthcare, and now that it's comprehensive? Talk a little bit about that.
Yeah, that comprehensive piece is so important for us. It becomes all-encompassing, and it really becomes our responsibility to really look out there. And one of the things I challenge my team with, and I couldn't do any of this without a great team. It's so important to have a good team working side by side with you, and I've got a phenomenal team both on the Laurel side and on the UPMC Wellsboro side, and we work so great together. But it really is identifying that curiosity piece, and that's one of the words we injected into our vernacular, curiosity, because without curiosity there can be no innovation. So I challenge everybody, whether they work in an individual office or whether they're all the way up in my office on the leadership team. I want to know, what if Laurel did fill in the blank? And when they come and say, hey, what if Laurel did this? And we say, yes, that's a great idea. Let's research that. Let's see if we can do that. Let's see if we can bring that service up here to a rural part of the state. So we're very proud of the fact we opened the area's first wellness center in Mansfield. And that's really something we're going to replicate throughout the county on a very quick basis, because wellness is such an important part of everybody's life.
Explain to folks what exactly do you do at the wellness center?
Yep. So right now in the wellness center, we started out there taking a big swing at the opioid crisis. I served on the County Opioid Coalition for a couple years, and I really believe the health centers need to be at the center of this. We have so many great organizations that are working together to pull this off, but the health centers really need to be at the center. The doctors, the nurses, they're the ones that see these patients every day. So we wanted to have a place that they could go to get their treatment. We were sending them to other areas of the state, down as far as Williamsport or even further, and we want to do that care right here locally. So right now we're offering Suboxone treatment in that clinic. We've just hired our first addictive medicine specialist. She just started with us on Monday, and she's out rounding in all our centers right now, learning the providers, learning the physicians, learning the nurses, and then she's going to bring an addictive medicine, a whole patient approach to that treatment. So what that means is if you come in and you are plagued with an addiction, we're going to take care of that, but we're also going to treat the other health concerns as well, whether that's diabetes, hypertension. We're not going to send you off somewhere else to get that taken care of. It's that whole patient approach.
Well, typically in the opioid struggles and addictions that we see, there's usually a trigger that's brought this on.
Yes.
And so I love your approach to holistically looking at how we can help these folks really overcome these challenges, because there is hope. We've seen folks that have gotten through this, and you guys have really done a phenomenal job to really assist in that. Talk a little bit about the partnership with Northern Tioga School District. This is one of those. I love how you guys dream big, and you know, I think I like to think I do the same thing. Like we try to think creatively, and we'll take it as far as we can. And if it works, great. If it doesn't, then we at least gave it our best shot. Talk about what you're doing with Northern Tioga. This is exciting.
This is really cool. It really is. And I was actually up in Northern Tioga last night talking with their superintendent, Dr. Barnes. She and I had another great conversation about this. We actually want to bring healthcare. We want to bring healthcare out of the clinic setting right into public education. We want to put practitioners in public school where the kids are every day, you know, all day from 8 to 3, they're in the school every day. If they have to access the health system, their parents have to take time off work. We have to pull the child out of the learning environment. We have to get them to the clinic. They get seen. And then oftentimes, because of the complexity of just transportation or whatever, they don't make it back to school. So absenteeism's on the rise. Learning is suffering. We want to bring that healthcare right into public education where we can dispense it at a place where the kids are every day. So instead of missing a half a day or a full day, they're out of class for 15 or 20 minutes. So we're going to pilot this in Northern Tioga. And when you talk about dreaming big, this really grew out of an idea that the team had. we sat down and talked about it and said, yeah, it'd be kind of cool. We're going to try this up in northern Tioga.
Wow.
I had some conversations, and I came back and told the team, I want to pilot it here in the back half of the school year, but our goal is to be in all 3 school districts by the 2021 school year. So by August, September of this year, operate in all 3 school districts.
Wow, that's exciting. I mean, that is one of the challenges. We talk about challenges that we have in rural healthcare. Transportation is a big piece of it. Getting folks to and from the doctor's office is challenging, and a lot of folks, especially with that are working full time, it takes 15, 20, 25, maybe a half an hour to get somewhere to be seen. So that is so exciting that you guys are doing this. I'm excited to see how this plays out. And one of the other things that I know that you and I have talked about quite a bit, something that Representative Baker had been working on. We picked that mantle, and I'm really trying to push it down the line, would be the credentialing challenges for credentialing physicians. And folks may not understand how this works. So basically, if you hire a physician, they need to be credentialed by an insurance company typically in the state, but mostly the insurance companies are where we're seeing some challenges, and that can take 6 months, 9 months, and it's incredibly challenging to attract physicians to an area like ours. Now, we have great schools, we have affordable property and real estate, outdoor options that second to none.
Yeah, it's a paradise.
It really is an awesome place.
Yep.
But getting through that credentialing process takes an unbelievable amount of time, and we really don't know how long it's going to take. So this bill basically says, hey, you have 45 days to do it.
Yep.
The process needs to be done and done right. We need to make sure that we get qualified physicians to the area. But it says you have 45 days to do it, the insurance companies.
Yeah.
How big of a deal would this be for you guys at North Penn Comprehensive Health System?
This will be huge, and I can take it back to an example. We have a practitioner here. She started in the summer months. She's PAR'd now. She's credentialed through most insurances, but there's still one that's hanging out there, and she's been here for almost half a year. So what that basically means is we can't serve patients that actually are partnered with or that choose that insurance. When they come in, and if we see them, we can't bill for that service. And while we do a lot of philanthropic care, we do a lot of humanitarian charitable care, that's really the foundation of North Penn and Laurel. We're still a business. We still have to pay to keep our lights on, and we do that through charging the insurance companies in a fee-for-service basis. And when they can drag their feet for sometimes, like you said, many, many months, it makes it very difficult. And it's not just the financial aspect. It really is about patient care. We want to have a patient-centered approach, and when we bring in a new clinician, doctor, nurse practitioner, chiropractor, dentist, whatever, we want to be able to tell our patients, come one, come all. We've brought this service to a rural part of the state. We're now providing you better access, so you don't have to drive to Williamsport, or you don't have to drive even out of the area down to State College or Harrisburg, as far as I hear some people have to go. We want to do that service right here. Come one, come all. We'll take care of you. But then we have to put our hand up and say, oh, wait a minute. If you're with this insurance, we can't see you just yet. And I really applaud you. Thank you very much for picking up the mantle with this and pushing this bill through the House as strongly as you have. And I can urge everyone out there, if you have a relationship with your senators, call them, get on their website, send them an email. This really needs to make its way through the Senate because it's that important. And it's not just for Laurel. It's not just for North Penn. It's for all practitioners.
Yes, all practitioners across the whole state.
Yes.
But it typically hits rural communities harder, I would think. And we have really worked and negotiated with insurance companies and stakeholders involved in this, and it's been a process. We've got it as really. I feel like it's a good compromise for everybody.
And
that's what we got to do.
Compromise.
With some of the stuff that was in there in the past that was kind of hanging it up, we worked with them on that, and so we're hoping to see this move. So, like you said, if anybody listening to this could reach out to their senators and say, hey, it's House Bill 533. We need to see that moved here before the end of the year would be wonderful, and that would be a really big deal for us. So, quick question for you. We talk about trying to attract good, awesome, super qualified physicians to the area. give your best pitch to somebody that may be listening to this, that's thinking about coming and serving in rural healthcare.
Yep.
Give your best pitch to somebody that might be listening.
The big thing we talk about here is really why you want to get on this train, why you want to join North Penn and the Laurel system, is we're a system with a vision. And that vision is we're a clinician-driven organization. So what I mean by that is I don't sit in my office and dictate policy. I don't say, this is Jim Noble's health system, and here's how you're going to practice medicine. We want clinicians to come here, bring that curiosity, bring that innovation, and say, this is what jazzes me up about my practice. This is what I want to do. I went to school for a decade or longer to learn my craft, and now I want to master it. And I don't want to come here and have an administrator tell me how I have to practice. So we want them to bring those innovative ideas here and say, you can get on this train and go somewhere with us, and we can grow the service together. Whether it's chiropractic care, we're the first organization in the area that offers chiropractic care as part of a health system, and we bring that all the way down to all our patients. If they're on medical assistance, if they're in between there, if they're kind of in that classification where they don't have insurance or they're underinsured, we'll slide their fee down based on their relationship and the federal poverty level. We can do great ideas like that. But that's really what the pitch is. We're a wonderful community in north central Pennsylvania. We have a lot of outdoor activities, if that's what jazzes you up. If you love to be outdoors, if you love to ski, hike, bike, anything outdoors, camp, this is the place to be. And I always promote, we're not going to sell who we are. We're not close to an urban environment. I've heard in the past, we're 4 hours from New York and a few hours from Philadelphia. That's not what sells our area.
Exactly.
Come here because we have great schools. We have a great community. It's a place where you know and trust your neighbors. You can walk down the street and people are going to say hello to you and ask you how you are. But more importantly, we're building a system here that we can have long-term sustainable health care for the area. And I'm pretty proud of the fact in the last 2 years, we've attracted 16 new clinicians to North Penn.
That's awesome.
It's great.
Well, and they are part of a team. They're part of a great community, and we would love to have them here. Like you said, we don't apologize for being rural.
No.
We pride ourselves on that. We love the fact that we have a little bit of a slower pace where we can enjoy the beautiful surroundings and the relationships that we're building with friends and family.
Yeah,
so
that's absolutely true.
It's a great place. Well, thank you for all your work, Jim, and your passion for rural healthcare. It is so evident, and I love your creative ideas. Keep it up, and come back and see us anytime. Look forward to continuing to chat.
Yeah, I'd love to come back, and thank you for everything you're doing. I can't say enough about everything you're doing. It's great to have a partner that I can pick up the phone, I can call, I can text and say, hey, Clint, can you help me out with this? We're just trying to make things a little bit easier for a lot of the residents around this area, and we're going to do some great stuff in the coming years.
Well, I appreciate it. We're all on the same team. We got to work together.
Yep,
so
thank you.
Thanks for joining us.
Absolutely.
Thank you for joining us today on Conversations with Clint. It was so exciting to have the CEO of North Penn Comprehensive Health Services, Jim Nobles, right here in the studio to talk about his passion for healthcare in rural communities all across the Commonwealth of Pennsylvania. I hope it was very educational, and hopefully you understand House Bill 533 and the importance of that bill a little bit better here today. If you would like to schedule a time to stop into our office and talk about any state-related issues, feel free to call 570-724-1390. Look forward to talking to you soon.